watching Mental Health with Marcie, and I'm Marcie. Today's video, we're going to talk about living with chronic pain and depression. And if you are or have ever lived with chronic pain, you know how much that sucks. And the same thing with living with chronic depression. Those are both things on their own that can really be debilitating and really impact your quality of life. But it's super fun if you just mix them together and then make it even doubly worse. And so I want to explain a little bit of what it's like living with chronic pain and chronic depression, kind of how they impact each other, and then just kind of how I've coped. We'll do coped in air quotes. You'll see at the end. But yeah, living with chronic pain is extremely difficult, especially because it limits a lot of what you can do. And so, of course, that depends on where your pain is. But for me personally, I have chronic neck and back pain. I would even say like undiagnosed, as in I haven't found a cause for it and really much treatment that helps. And so it's just one of those things where I live with it every day and can't get rid of it. Not yet. I don't know when. And so you can already see kind of that depression coming in a little bit, because a big sign of depression, kind of hopelessness and not really seeing the light at the end of the tunnel. And so, living with chronic pain, it's hard to see, am I ever going to not be in pain? Is this ever going to be over? Is this ever going to be figured out? And so it's definitely been a hard journey, not knowing, what's wrong with me, not having effective treatment, and then also just being limited by the things that I, would like to do. That's again where kind of comes into a mental health sphere, is that, some of the things that I might want to do for my mental health to improve myself, I can't do because I'm limited by the pain, right? I might want to go do some yoga, take a walk, even drive to see family, and that's something that is painful. All of those things, sitting for too long, sitting like I'm sitting right now, just normal, is painful. And so it's like you want to do the things that you want to do, but you can't physically do that. And that, again, is a really big parallel to depression, because a lot of times when I'm depressed, I would like to do things to make myself feel better, but I just can't. And so having kind of that level of like hopelessness, or not like being in a great mood to begin with, and then adding on the chronic pain, it just really just exacerbates both conditions and, makes them both so much worse than they already are. And so that's why I don't have any clear answers for how to cope. I'm just doing my best, but it is just, it's the worst. And honestly, I would imagine that people with chronic pain may even develop depression. I struggled with depression before I had the chronic pain, but it wouldn't be surprising, just given what people have to deal with on a daily basis and not really having the answers. And the same thing for me with going to so many different doctors. That gives me like even more anxiety than I already have from a mental health perspective. Just trying to find someone to help me and not really being able to, just going to so many doctor's appointments. It's just, not been good for my mental health. And so I could see how it definitely can worsen depression, chronic pain can. And the same thing when you're depressed and you're not really wanting to do things, or at least for me, not really able to do as much as I'd like to do, then sometimes I'm, kind of stuck in this like rest position, I guess. And then I don't end up doing anything that would help my pain. Like maybe it would help to do a little bit of something, a little bit of like exercises even that are for the pain. But it's like when you're depressed, you don't want to do anything. You can't even sometimes shower or wash your face, like much less do physical therapy exercises or go to all these appointments. And so it's, again, just not making the chronic pain worse by having the depression. And so it's really a dangerous combination, to be honest, and something that I would not wish upon my worst enemy, just because It's something that I don't feel like I have any answers. And that's, I think, the worst part of it is just not feeling in control of the situation. And so that's, with depression, a lot of times can't control it. It just kind of happens and you're like, why am I in this bad mood? Why am I depressed? Like everything's going fine. Fine. But even when it just feels like it comes on for no reason and I can't control it, and the same thing with the chronic pain, I definitely can't control that either. And so really all I can control is my reaction to it, and I don't know that I'm doing the best job. Apparently this is like the video of air quotes. Don't know why. I don't even know if they're in fashion anymore. Probably not. But I'm just trying to give myself a break, I guess, is really my coping mechanism, is just, I guess, giving myself a break and not pushing myself too hard, and then kind of acceptance that it's not always going to be this way. Maybe eventually, the depression will be better treated once figure out the right meds, and then, the chronic pain, hopefully eventually I'll have some sort of answers and, reason why it's happening and better treatment. And so just realizing that, my today is not my forever is like super hard to realize, but that's in my coping plan. Whether I do it or not is a different story, but trying to just really survive and just hang in there best I can is really all I can do right now. I mean, I wish I was able to do more of the things that I want to do. Again, limited by the chronic pain and the chronic depression. It just really sucks being limited to what you can do, but I'm just trying to maintain a little bit of hope, a little grain of salt somewhere. You can't even see it, so small, but some bit of hope that eventually, there will be, more recovery for my chronic pain and depression. So if you are dealing with anything similar, I totally understand and sympathize with you, and hope that you can get some answers and treatment yourself that is effective. But I appreciate everyone listening to my little rant about chronic pain and depression, and hope that you are well. So thank you so much for watching, and stay well, my friends.